Today, I'm going to be giving a brief introduction on adverse childhood experiences and what that might look like in the dental office. Stay tuned. Hey everyone, welcome back to the Grow RDH podcast. My name is Katie. I'm a dental hygienist from South Dakota. And last week on the podcast, we did an episode about trauma responses that you might encounter in the dental operatory. We talked about fight, flight, freeze, or fawn. And I briefly introduced ACEs and talked about ACEs. And so today I'm going to give a more thorough introduction to adverse childhood experiences, or ACEs, and talk about what it means for you as a provider and what it means for you as a community member. If you're new to the podcast, I want to welcome you. Thank you for joining and listening in. Go ahead and subscribe if you like content like this. We talk about all things dental hygiene, and in this case, it's not dental related. And this is one of those topics that's really important to me. As I said in the episode last week, that we train our students to learn about ACEs. And what we're going to talk a lot about today is community, and why, even if you're not clinically working right now, this still matters, because what the goal behind the ACEs research and the ACEs training and basically just spreading the word about ACEs is to build resilient communities and build communities that can reduce adverse childhood experiences as well as help people become more resilient. And that's important for everyone. So I'm first just going to introduce adverse childhood experiences. The original ACEs study was done on a not very diverse population. This was done in California, and it was done in the late 90s. I think it was published in 1998. And the population was not diverse at all, but what they found was that even in that not very diverse population, that ACEs exist, and they are highly linked to a lot of systemic chronic illness. In the questionnaire that they sent out, they screened over 17,000 patients for different types of trauma. There were three main categories. The first category was household dysfunction. Under household dysfunction included substance use, parental separation, mental illness, having a battered mother, and any criminal behavior in the family. The next category was neglect, both emotional and physical. And then finally, the third category was abuse. And this could have been emotional, physical, or sexual abuse. With those three categories, in the original study, there was then 10 ACEs. Well, we know now that there's a lot more things that can happen to a child that can be a traumatic experience. So I think what we know now is that, yes, there are way more than just 10 adverse childhood experiences that somebody can experience. But that was the original research, and a lot of the studies are founded on those original 10. Then they looked at the chronic illnesses that these patients over their lifetime were experiencing. And what they found was that having 4 or more ACEs especially put these patients at a higher risk to experience these things within their life. These things include chronic depression, alcoholism, serious or persistent mental illness, suicide attempts, IV drug use, incarceration, and really just overall life dissatisfaction. The way that this can be explained using neuroscience is that as we grow and develop in childhood, is that our synaptic density changes over time. Through adolescence, we have a bloom of neural development and neural connections being made because we're experiencing everything as it's a new experience, right? So all these different connections are being made. But over time then, as we get towards puberty, is that those connections get pruned away. And the connections that are the strongest are the connections that remain. So if we are experiencing a lot of stress, a lot of trauma, we are making those connections stronger. And what we're left with is coping skills. Some coping skills are positive. All coping skills are necessary, right? We learn specific coping skills through the connections that are made in childhood. And those connections keep us safe. They keep us alive. They keep us out of harm. So I don't want to say that all coping skills are bad, right? We learn coping skills by the environment that we're in. But unfortunately, sometimes those coping skills may be maladaptive when we are in different scenarios. One of my favorite speakers to hear talk about adverse childhood experiences is Dr. Nadine Burke-Harris. I'm going to link her TED Talk below so that way you guys can go and listen to it. It's absolutely amazing. She says this far more eloquently than I do. But the example that she gives when you're thinking about adverse childhood experiences is the example of being out in the woods and you see a bear, right? Your body puts you into a fight or flight response and it helps you stay alive, right? You're either going to fight the bear or you're going to run away from the bear. But that response is a stress response. That is good. We need the adrenaline and our body needs to, get that blood flowing. And so that way, if we do want to run away, we have all of the oxygen and we have that adrenaline for power and energy. That's a good coping skill if you are experiencing a bear. But the example that she gives is, what if that bear is living in the house with you every single day? That changes your perspective of sometimes what these kids are going through in childhood is something that we would never imagine to think about because we aren't in that scenario. So having hypervigilance and having strong reactions towards things that may have kept them safe in the past don't always transition into society or community because maybe they're not in a situation where they have to be in fight or flight all the time, but their body doesn't know any different. If you think about this in terms of professions, right? There are certain professions where that type of response would be very good. If we want to think about first responders, EMTs, emergency room nurses, those types of scenarios and settings would be perfect for somebody who has the ability to respond quickly or work under really high stress situations. But if you think about a kiddo who might react that way into a high stress situation and you put them in a classroom and you tell them they have to sit nicely and they have to listen, not make a sound, they may not thrive in a specific setting where they're not used to being. The good thing is that people that have those coping skills may be able to survive under the worst conditions, but sometimes they struggle thriving when conditions are really favorable. On the flip side, people with low resilience and low coping skills may be able to survive and even thrive in good conditions, but they may not be able to survive in the worst conditions because they don't have this coping skills to do so. I think what's important here is, and especially for this first episode, I'm going to do a few episodes around ACEs. So please stay tuned. Make sure you subscribe so you're getting all of this information. But for this first episode, I really just wanted to introduce it and to provide you with resources. Like I said at the beginning, the main goal behind ACEs training and education is that we build competent communities, communities that are able to identify trauma and to guide people, not just kids. There are tons of adults who have unhealed trauma and have experienced those things in childhood that maybe now as an adult have led into some maladaptive coping skills. So we as a community, as a dental office, as a town, as a person, interacting and living in that town, we have the opportunity to spread awareness. And that is what I want this first episode to be. This is just awareness. I definitely invite you to visit the resources down below that I'm going to share and educate yourself as best you can about ACEs and about what it means to be a confident community. A lot of the times, if we can co-regulate in the dental chair, which is what I talked about last week, co-regulation, we may be the first safe healthcare provider that person has encountered. And what a beautiful thing to be able to co-regulate emotions with somebody in your chair, providing them with safety when maybe they've never felt that before. Over time, the goal then is to get people, not just patients, people to a place where they can self-regulate, right? And this is not all on us. This is not our work to do. But I think it is our work to educate and spread awareness. What we know through the CDC is that ACEs are dose dependent, meaning the more ACEs somebody experiences, the more likely they are to experience all of those problems we talked about at the beginning. And a lot of the times, if you look at those 10 types of ACEs that we talked about, they coexist with each other. If you have a battered mother, you probably are more likely to be experiencing that same abuse yourself. But what we also know about ACEs from the CDC is that ACEs are preventable. Identifying people at risk and providing resources for people at risk to protect them from future violence should be something that all community members in any size community should be concerned about and should be working toward. When we can create that safe place for a patient, young or old, we are creating a safe environment. And when we provide resources and provide referrals to social workers or other community resources that are available, we can also help move them towards a safe environment at home as well. So that is the main focus of today. I hope you enjoyed. The CDC is doing a ton of good work in this arena, and I highly invite you to look into how you can bring this information to your community by either looking for an ACEs trainer in your area or maybe even becoming one yourself. If you like this content, please like, share, subscribe, comment below if you have experience in ACEs or if you have encountered those patients with trauma responses and how you responded to them. I will be back with a new episode next Friday and we will be talking more about ACEs. So stay tuned and I will see you then.